Hello, thank you for the invitation from World Federation of Acupuncture and the Moxibustion Society to join this WFAS 2021 International Symposium Acupuncture Moxibustion online session, United States of America. My name is Dr. Liangl. I am a licensed acupuncture physician in the state of Florida of United States of America. I'm also a doctor of Oriental medicine. I studied medicine in 1980 and graduated in 1985 in China. I'm a doctor of medicine. Currently, I'm practicing at the Center for Acupuncture and Oriental Medicine. Ladies and gentlemen, today allow me to present dimensional acupuncture. So as we know that we're going to talk about TCM, the three treasures, there are Qi, essence, and the spirit. In order to nourish Qi and blood, we need to address the spirit. So there we have three triangles. And in our routine life, we call human body a golden triangle. You look at that figure, that is a golden triangle. In Chinese, everything is good, we call it golden. So the human body has golden triangles everywhere, including if you see that big figure or knee area, or even the points, channels, meridians, they're creating a multiple triangle, dimensional connections. Those triangles are the intersections of organs, internal organs, zangfu, blood vessels, nerves, meridians, and acupuncture points. As we read from the classics, from acupuncture Dachen, the Symposium of acupuncture in the Ming Dynasty, it says, the essentials of acupuncture treatment are all based on broad rationale. That means we are based on our broad rationale to engage in the theory that we apply to our practice and to eventually prove effective. If it is effective, we can educate people to use them to get more information about the situation. So my theory about the triangular acupuncture or dimensional acupuncture is a theory, but I applied that into my clinic practice. I saw great results. I cannot wait to share those information with you today. We have not been able to draw up acupuncture points well, according to the current medical model. We're now talking about acupuncture points in a state where the meridian cannot be even explained. What is meridians? What is channels? What is collaterals? Without the support of this theory, acupuncture point will not shine in all fields of our acupuncture clinical and even scientific research. From our earliest research on acupoints and the relationship to internal organs, to research on needling sensations, we're now pushing our understanding of acupuncture points, the stimulation effect, and exploring the rules of high level of the life science. However, we have to understand what is meridians and channel trapeziums. There's a math. How do we use mathematical method to explain these points? There's a statistical phenomenon hidden in the clinical acupuncture and Moxibustion society. For example, in a clinical environment, a patient may use certain acupuncture points, but for several different patients, can we still use the same points? For example, if you are treating migraines, you got great effect with a set of points. But that doesn't mean in traditional Chinese medicine that your next migraine patient, you should apply the same set of points. So that cannot be utilized as a golden rule. We may use different points combination along the meridians according to the patterns based on TCM. There's a statistical probability problems implicated in this, which means that for isolated acupoints, it may embody the local or even whole body modular biological effects brought about by body surface stimulation, but a set of acupuncture points, or to be precise, a series of acupuncture points. It is targeted meridian effect. I cannot agree that more. Only the group effect, that is, the group effect of our group of acupuncture points or series point combinations, we can have a regulatory effect on diseases and internal organs. This is the significance of our research on distribution characteristics of acupoints. It can explain the meaning of traditional meridians. Is that possible that this traditional meridians is a geometric expression of the existence of acupuncture points by the ancients? How do we complete the proof of this proposition? The group performance of acupuncture points like the meridians is difficult to be displayed on the same person at the same time, but the transmission of this senses along the meridian is another proposition. We can observe the effectiveness stimulation points and the effective intervention points of acupuncture points on the body surfaces. In fact, it has quite a strong individual and dynamic characteristics, but the meridians are not lines. It is very likely that it is a phenomenon of the kind. Description of the regularities. What we may do now is not to follow the diagram, but what we are more likely to do is to find the law of meridians link, like blind person. So here it goes. I accidentally find a so-called Buddha's triangle, and it is a very effective 3 points combination on the wrist component of lung 9, heart 7, and the pericardium 6. And this comes with the story. One day, I have a patient that happened to be a surgeon. So we engaged a lot of conversation, and he had great results with acupuncture. So he really believed acupuncture helped his migraine. Therefore, he referred his patient to us. And I didn't know that until one day he asked me, my patient says, for many years, chronic insomnia has been treated by one acupuncture treatment that he fell asleep the same day. I was puzzled looking at him. I said, who are you talking about? And this doctor says, oh, maybe it's one of your other doctor treated him, but anyway, he got great results. So I find out the patient name and I looked at his file. I found out this is 80 years old male that has struggled for insomnia for many, many years, even taking medications such as Ambien or other tranquilizers without significant effect. And on that file, I found a medical record. I find that my colleague uses so-called Buddha's triangle, along with regular points like yin tang, GB13, spleen 6, heart 7, liver 3, etc. So I felt it's amazing. I saw the medical notes that this patient, they returned second visit, reported great improvement in his sleep after just one treatment. I was astonished by this method. Therefore, I engaged a conversation with my colleague. Her name is Dr. Milligan. And she says, I was wondering, I said, where you found this so-called Buddha's triangle? She says, I learned from online courses. I'm utilizing them, and it's very effective. I said, do you know the name of who found this and where it's come from? What's the theory behind? She says, I have no idea. Now, since then, I started to use this triangle for my patient. I found it's indeed effective, not only for insomnia, but there's a powerful tranquilizing effect, including anxiety, manic depressive disorder. And I found even it strengthens the heart functions. It boosts the lung qi. So I get more and more into this. That's where they come from. Second, back in 1997, my mentor, the world well-known auricular queen, Dr. Li Chunhuang, and she found it after she's already well-known in the field of auricular medicine. And right before there's a Florida convention of acupuncture and the symbolism, she told me that she found 3 points that is very effective for neck pain. Her theory is, if the neck pain is on the posterior of the back, and it's affecting the Taiyang channel, and it is on the yang meridian. So auricular have a characteristics that is same side ear, treat the same side body. She said, well, if correspondingly to that relationship, I should use the yang side of the auricular points to treat the neck pain. And indeed, she published her findings, people reporting a great results with this triangle, which is the mirror of C34, C67, and acupuncture points she invented on the ear called the large auricular nerve, but it's on the posterior of the ear. Therefore, she created her so-called auricular neck triangle. And same theory, she also developed auricular lumbar triangle, which is very effective for treating lower back pain, sciatica, or bursitis of the hip, or even hip joint problems. And those 3 points are a component of the auricular points, popliteal fossa, sciatica nerve, and the lumbar sacrum on the back side of the ear. Therefore, I've been using them in my clinic, and those give me the insight. Since I am the student of Dr. Li Chunhuang, I used her points, so-called Liangl's auricular Shen triangle. And those Shen triangle initially just treating patients by using their names, such as Shenmen. You can see the Shenmen point in the triangular fossa, and Dr. Li Chunhuang's neurasthenia zone. That is a large zone at the end of the helix and at the beginning of the antihelix. It is above, superior to the earlobe. Those called anti-neurasthenia area. And one point on the earlobe, which is called neurasthenia point. I randomly used these 3 points. I found the patient have a profound relaxation effect, and insomnia, anxiety, even depression has improved. Therefore, I start to draw this diagram. I realized that is a magic triangle. And therefore, I invented another triangle, which component a extraordinary points called a thinking point. And thinking point is from Dr. Fang's microimaging scalp acupuncture point that is primarily stop people overthinking pattern. Okay, and that point is located between yin tongue and the front hairlines. It's right in the middle. But if you draw a triangle, if you draw a equalized triangle, you find those 2 points that is happening to be the point that calm the mind, gallbladder 13. And those are called the root of the Shen. And I created this frontal triangle, which utilizing with auricular Shen triangle, the powerful effect even showing in the clinic. And therefore, I also found another triangle that in my practice is to using Buddha's triangle along with people. I often use kidney 6 and spleen 6 to treat the problems of insomnia. Now, because that situation, especially this year, I start to using the liver channel a lot due to COVID-19 crisis. So liver 3, large intestine 4 is often used in the clinic. When I use that, I'm creating a food triangle, which component of liver 3, spleen 6, and the kidney 6. Guess what? The result is fantastic, fantastic. Therefore, I call it 4 triangles, 4 triangles. And those are frontal triangle, auricular shin triangle, Buddhist triangle, and the foot triangle. I know my time is limited. I will stop right here. But however, those 4 triangles can be applied in almost any complicated conditions, because I believe that in Chinese medicine, we call body, mind, and spirit. We are not just treating the body, and we'll link with the mind and the spirit, that triangle, because numerous modern conditions are created by emotional stress. Without addressing the shin problems, you are not able to address the body sufferings. Without addressing the shin problems, you cannot address the spirit problems, motivation. I have a video I'd like to show you about this magical combination of 4 Dr. Liang's shin triangles. That patient is a female Caucasian, is 48 years old. Her chief complaint was hypertension, blood pressure ranging from 120 systolic to 180, diastolic ranging from 90 to 100 to 110. And I rule out any medical danger situation. That's why I agreed to treat her. She had a migraine at that day, and she had severe palpitation. So my TCM diagnosis, it was spleen, qi deficiency, liver qi stagnation, severe stress. So my treatment was not focused on immediately to treat her blood pressure or treat her migraine or treat her palpitations. Instead, I only used the 4 shin triangles. Please look at the clinical results. It takes a little bit of a while to load. Thank you so much for doing this video. Do you have permission to do this video for educational purposes only?
Yes.
Thank you so much. So this is your second visit. Are you probably here for what? Can you tell the audience?
I had extreme fluctuations.
Hi, Susan. Thank you so much for doing this video. Do you have permission to do this video for educational purposes only?
Yes.
Thank you so much. So this is your second visit. Are you probably here for what? Can you tell the audience?
I had extreme fluctuations in blood pressure from very, very high, then it would go down to very low, and also migraines. And just after the first treatment last week, I had steady blood pressure the entire week in a very normal range. And also my heart rate went down. I was having problems with a high heart rate as well.
So Susan coming in today, I just repeat the treatment. She coming in for hypertension and a migraine. After first treatment, she's very impressed. Actually, treatment protocol is very simple. I did 4 triangles, okay? So the head is called the head triangle, and the component of thinking point, 思维, and GB13 function. That consists of Dr. Liang's auricular Shen triangle, which is Shenmen, neurosenia area, and a neurosenia point. It consists of Buddha's triangle, which is component of Liangl 9, R7, PC6. Taiyuan. I don't use two. I do Shenmen point. And neurosenia zone, you want to use more than one needles. That's a big area, okay? And that's accurate and more gentle to the patient. This needle is only ½ inch needle. That's the neurosenia point. And come here for Buddha's triangle. Your hand a little bit this way. And very gentle treatment, R7, Liangl 9, PC6. In Chinese, it is Shenmen, Taiyuan, and Nuiguan, okay? And then we're going to foot triangle, Taichung, liver 3, just like that. Okay, kidney 6, Tai Chi, just like that. And Sun Jiao spleen 6, just like. We retain needle for 30 minutes, and patient come twice a week. Thank you so much, Susan. Okay, so that is the video showing a wonderful results of 4 triangles. It is part of the dimensional acupuncture. Thank you very much. Goodbye.